this would be a good time to begin.
Great.
So, okay. So are you ready, Rich?
I'm ready.
Okay.
Take it away, Alan.
Welcome, everyone, and I am Alan Brownstein. I'm the CEO of the National Blood Clot Alliance, and welcome to the pre-launch celebration of the new and innovative online curriculum, Stop the Clot, What Every Healthcare Professional Should Know. In addition to celebrating the launch on behalf of the National Blood Clot Alliance, we are here today to thank and recognize those who made it possible. And here is our agenda. But before we get started, here is some information that you will need to know. To the right of your screen, you will see a chat window, and we recommend that you minimize the chat window for full screen viewing. Simply click the orange arrow on the upper right part of your screen. However, if you have a question or a comment, you will need to click the arrow to get back to the chat window so that you can post your question or comment. And then these will be submitted during the meeting, and at the end of the meeting, our meeting organizer, Rich Petroki, will read your questions or comments. The Stop the Clot, What Every Healthcare Professional Should Know, is made up of 5 distinct lessons. First is the basics of clotting, then the basics of thrombophilia, anticoagulant medications, post-thrombotic syndrome and pulmonary hypertension, and the prevention of VTE recurrence. The overall purpose of this curriculum is to help health professionals combat blood clots, and doing this by arming health professionals to stop the clot. Now I would like to introduce the president of the National Blood Clot Alliance, Randy Fenninger. Randy.
Thank you, Alan, and thank you to all of you who are participating in this webinar today, who've joined us both as panelists and as our audience. We're very proud to be launching this curriculum. The mission of the National Blood Clot Alliance is to prevent, diagnose, and treat thrombosis and thrombophilia through education, support, and advocacy. And this curriculum is a key portion of our education initiatives on behalf of patients and health professionals. Looking at this event from a patient perspective, it's very exciting that we're arming health professionals to stop the clot through the material that has been developed in the curriculum. We see patients and their families as the ultimate beneficiaries through improved care that health professionals will learn about through this curriculum. Use of the curriculum means that blood clots will be prevented and lives will be saved, and that is the ultimate goal of our organization. I want to express the appreciation of the entire board of the National Blood Clot Alliance to the curriculum development team who worked long and hard to put together this excellent program that we're launching today. I especially want to acknowledge 2 members who, while they were serving on the curriculum development team, also served on our national board and our medical and scientific advisory board, and that's Liz Varga and Stefan Moll. They've been great stalwarts in not only this activity, but in the building of the National Blood Clot Alliance. And I especially want to extend thanks to the Centers for Disease Control and Prevention and all of the staff at many levels who have worked with us for many years to get us off the ground and running, and who continue to be our partners and contributed so much to the development of this curriculum. Without their support, encouragement, this wouldn't have been possible.
Thank you very much, Randy. And now the chair of the Medical and Scientific Advisory Board of the National Blood Clot Alliance, Dr. Jack Ansell. Jack?
Thank you very much, Alan, and thank you, Randy, for allowing me to participate in this celebratory event. I am really delighted to say a few words and to congratulate the team on this outstanding achievement. As I have reviewed the curriculum recently and and a little bit during its development, and hopefully added a little help myself to its development. This really is a curriculum that will benefit nurses, nurse practitioners, pharmacists, and physician assistants primarily, as well as physicians. But these first three groups of individuals are really the ones who are responsible for taking care of so many patients, and I know this firsthand from my extensive experience of working in anti-coag clinics and seeing the people that run these programs and have direct contact with patients. So it is really critical to that group of individuals. From a medical perspective, this curriculum will clearly close the knowledge gap among health professionals and, in a sense, create a level playing field, and it will really help to promote comprehensive care for those with clotting problems. And that those individuals are the members that make up the National Blood Clot Alliance, and we are dedicated to our patients and to the public with these problems. So in summary, I really also, as Randy said, want to thank the curriculum development team for an outstanding job. I think this really is a step forward, and also thanking the CDC for their help and support in this initiative.
Thank you very much, Jack. We are honored to have with us today Dr. Ed Trevathan, the Director of the National Center for Birth Defects and Developmental Disabilities at the Centers for Disease Control. This is where the Division of Blood Disorders is located, and this is the focal point for blood clots and clotting disorders at CDC. Ed?
Thank you, Alan. This is a real pleasure. We at CDC are very excited about this curriculum because we think it's an important component to really an overall approach to reducing death and disability associated with blood clots. And this is important for us at CDC not only because of personal interest on the part of many of our scientists and the scientific interest, but simply because deep vein thrombosis and associated pulmonary embolism takes the lives of at least 100,000 people a year and causes far more disability than that even. And so this is a real opportunity for prevention. And we are very happy about this curriculum. We believe it does arm health professionals with knowledge they need to do more to prevent death and disability. I want to just mention, someone knows how to forward that for me. Thank you. Sara Critchley, our project officer, has played a really key role in this curriculum development. We appreciate her leadership and commitment, and I just want to thank Hani Atrash, Dr. Atrash, our division director, for his leadership in this area, as well as Drs. Chris Parker and Mike Susi, also in leadership, that have championed this area of blood clot early diagnosis, treatment, and prevention. Dr. Craig Hooper, who's our branch chief for our laboratory and been a real champion of connecting the laboratory to public health to save lives, and Dr. Althea Grant, who's worked very hard on pushing blood clot early diagnosis and prevention as a key component to public health. And I'd like to just take the time to congratulate all of you at the National Blood Clot Alliance for your leadership and your commitment. You are making a difference, and this activity, I'm sure, will save lives. And a special thanks to the curriculum development team.
Well, thank you very much, Ed. And now we're coming to the moment that we're waiting for, and that is to recognize the enormous achievement of the curriculum development team, made up of health professionals on the front line of treating patients with blood clots and clotting disorders, as well as the professional leadership from CDC staff and the National Blood Clot Alliance staff, as well as volunteers. So now, welcome Brenda Risky, the chair of the curriculum development team.
Thank you, Alan, and thank you, everyone, for the kind words for this curriculum development team. I was fortunate enough to chair this team, but it really was a motivated group and hardly needed to have a chair. It's made up of individuals who have a lot of expertise, experience, and made a lot of contributions in time and bringing their experience to bear. Thank you to the team, Mary Lou Damiano, Linda Earle, Kathleen McCool, Stefan Moll, Sky Peltier, Elizabeth Varga, Diane Worth, Sara Critchley, Kathy Tenza, Mary Ellen McCann. Thank you all. It was everybody's participation that made this work. So I'd like to just acknowledge each person so you know who was participating. Kathleen McCool, a pharmacist from Kaiser in Denver. Mary Ellen McCann from the National Blood Clot Alliance and the director of the team. Diane Worth, clinical nurse specialist from Emory and Grady in Atlanta. Laura Earle, a nurse at the University of New Mexico in Albuquerque. Myself, and then Liz Varga, who's a genetics counselor, but also serves on the National Blood Clot Alliance board. Kathy Tenza, our instructional designer. Sky Peltier from the University of Minnesota, a physician assistant. And Sara Critchley, who served as the liaison with the CDC and offered tremendous insight from her perspective. And then Mary Lou Damiano from the University of Arizona in Tucson. In addition, there was Stefan Moll and other people that were on the team. But I would like to thank the National Blood Clot Alliance for this opportunity and the Division of Blood Resources from the CDC for providing the financial support for this and working together with us to do that. The Medical and Scientific Advisory Board from the National Blood Clot Alliance that provided input and gave reviews. Jack Ansell as the chair of that board for his input. Rich Quattrochi for his technical expertise, and of course Alan Brownstein, the CEO of the NBCA. Thank you. So, on behalf of the members of the curriculum development team and for all those affected by blood clots and clotting disorders, Stop the Clot, what every healthcare professional should know, is now launched.
Alan, did you want to say a few words?
Thank you. Thank you for the fireworks and opening the curtains, Brenda. Stop the Clot, what every healthcare professional should know, was officially launched. But this is the pre-launch. The official curriculum launch will take place tomorrow. The direct link to the curriculum and our press release was sent to your email just minutes ago. And now some closing comments from two people central to the success of this project, the National Blood Clot Alliance, the Director of Health Learning and Marketing, Mary Ellen McCann, and the project officer from the Division of Blood Disorders at CDC, Sara Critchley. Mary Ellen.
Thank you, Alan. And I'd like to say the curriculum development team deserves every superlative there is, and the screen could not capture everything positive I could possibly say about them. And I say it on behalf of myself, and I say it on behalf of National Blood Clot Alliance. They were a dream team to work with, and they all were expert in their fields. They work in the grassroots. They know the world of clotting and clotting disorders. They're delightful individuals. They're extremely dependable in terms of producing their product and their information and their lessons. They're always on time. They're very cohesive, and they're just a lot of fun, a true joy to work with. And I want to emphasize that what they devoted was time, volunteer time. So I really want to emphasize that and say how fortunate we are to have them working with National Blood Clot Alliance. Thank you so much.
Thank you, Mary Ellen. And now, Sara Critchley from the Division of Blood Disorders. Sara.
Hi, thank you, Alan, and of course I want to echo everything that all the previous speakers have talked about, but I also wanted just to share a little bit of why we at CDC and the Division of Blood Disorders and the National Center of Birth Defects and Developmental Disabilities, why we even started down this path and supported this very important curriculum, and I think it goes back to the patients. Before there was a NAT, before there was a National Blood Clot Alliance, we talked to a number of patients and heard over and over from them the need for as a community, the need for access to knowledgeable providers who could recognize and manage and treat both thrombosis and thrombophilia. So that's why we started down this path. And of course, our goal is, and I think Ed said this nicely, sort of one of the priorities for CDC is to prevent illness, injury, disability, and death, and certainly DVT and PE plays an important role in causing these conditions, and we hope through this curriculum it will be one more tool to prevent these. And we look at the potential impact of this as being vast, again, having access to knowledgeable healthcare providers who can recognize DVT and PE earlier and make sure that patients receive appropriate management. As Stefan Mall often said, and it really always struck a chord with me, we'd like to prevent mismanagement and misdiagnosis and misdiagnosis of DVT and PE. And then finally, I have to thank the curriculum development team and the National Blood Clot Alliance staff, Mary Ellen and Alan. You made my job extremely easy to work on this project. The dedication of everybody and the commitment to this has been one of the most gratifying projects I've had the pleasure to work on at CDC. So we thank you as well.
Well, thank you very much, Sara. And now on to next steps. Now we have to make it work, and to make it work, we need you to join us in spreading the word to healthcare professionals throughout the country, to the professional societies, the professional organizations, the websites, the professional meetings and conventions, through viral marketing and news releases. We have a marketing plan that's going to engage all those approaches to get the word out about this new curriculum. And in closing, I want to say thank you to the curriculum development team and thank you to the Centers for Disease Control. Indeed, together we can stop the clot. And with that, I would like to now pass this on to Rich with any of the questions and comments that you may have offered. And if you have not done so already, please type in your questions or comments in the chat box. And now on to Rich.
Alan, thank you for that. To send questions, just simply type them into the chat box. I've got a couple here already. One question is there a fee? Alan? Or Mary Ellen?
This is Mary Ellen, and there's no charge for the online curriculum.
I have another question here. I'll also direct this to you, Mary Ellen. It says, are CMEs available? And if so, how many?
Continuing education units are available, and the amount varies according to discipline and the awarding body.
Okay. Here's one. Can I take just a single lesson?
Can you take just a single lesson? Is that what I heard?
That's what it says.
Okay, no, I'm just checking that I heard it correctly. Yes, actually this is a curriculum that's divided into lessons because we want to honor the needs that individuals might have as learners. And although there are the 5 lessons that Alan described earlier, basics of clotting, basics of thrombophilia, anticoagulant medications, post-thrombotic syndrome, pulmonary hypertension, and prevention of VTE recurrence, if people feel equipped and already have mastered that information, they can select where they think the learning best suits individual needs.
Great. I got another question here. How long is each lesson, and can I go through it in more than one sitting?
Yes, you can go through it in as many sittings as is comfortable and convenient for you. And each lesson probably would take somewhere between 30 to 60 minutes, but it is individual in terms of pace.
Great. I've got one here that just came up. This is from Ed. Which major medical organizations provide CME?
Well, in fact, there aren't any CMEs. That you know. Oh, I'm sorry. Mary Ellen says that. Go ahead.
The application for continuing education units was done through the CDC.
Excellent. And I don't see any additional questions here. If anybody else would like to type a quick question, we're coming up on 26 minutes after the hour. So I think we're coming pretty close to our allotted time. Are there any other questions?
Well, once again, thank you everyone for joining us. And don't forget you can link directly to the curriculum before the official launch day tomorrow. It is available to you, and the link is on your screen, but it's also in your email boxes as we speak right now. So, along with the press release that is going to be issued tomorrow morning. Thank you very much, and have a great afternoon. Thank you very much. Bye-bye now.
And with that, I will be closing the meeting. Thank you.